I will kind of, there we go. And we are live now on Facebook. Jennifer Griswold here, and we are continuing our series called The Rebound Heartland. And with that, we're trying to address some topics that people have questions, concerns, feelings about as we try to rebound from what's going on with the pandemic. One thing that comes up a lot, nursing homes and long-term care facilities. How do we move forward in that aspect? Of course, we know this is an area that has been hit hard by the pandemic, and so many of us have loved ones who are being cared for in places like this, and we want to know what's being done. So joining us today in this conversation, we have Todd with AARP, we have Terry with the Alzheimer's Association, and we have Laurie LaMaster, who works with us here at KMTV. She's going to talk about her personal experience. Her mother is in a long-term care facility. Thank you all for joining us. We really, really appreciate it. So first of all, Laurie, I'm going to start with you. You talked about how recently, for the first time in a long time, you were able to see your mother. First of all, explain, when were you able to see her? How long had it been? And what was that experience like?
Well, thanks. First of all, thanks for having me here and for giving me this opportunity. And I do just want to start off by saying that I think my mom is doing really well, actually. She's in a lovely place in a little town in Iowa, Atlantic, Iowa, and I believe that she's being very well taken care of. But I did see her right before the lockdowns and stay-at-home started back in March. And just this last week, they started allowing outdoor visits with masks and distancing. And so last week was the first time that I had seen her, been able to lay my eyes on her since March. So that was really tough. We have been able to talk on the phone, my brother and I, and some of her friends, longtime friends back home in Iowa have been, but it's not the same, just being able to.
For sure. Todd, you were talking about 5 questions you were saying before visiting a nursing home. So AARP has put these out. Talk about what are these things you should be considering if, like Laurie, it's your chance now to go visit a loved one.
Yeah, this is the guidance our national office has put out, just questions that you can ask yourself and the facility where you're going to go visit. Number one is, what is a nursing home doing to make it safe for visitors? In Nebraska, the state has put out guidance on 3 phases for nursing homes, and you have to be in phase 3 for the nursing home to accept visitors. What kind of health checks will be required for visitors? Will they take your temperature? Will they ask you about your symptoms? So this is important not only for you to know that if you're going to go, that you're going to have these questions asked and you're going to have your temperature taken, but also to give you peace of mind that when other people are visiting, that they are also having their temperature taken and making sure that they're healthy when they're visiting. Our visits restricted by time and place. I think Laurie had mentioned that she had to get a specific time, and there's almost a reservation set up in order to be doing the visits. And so it's important to know that sort of time restriction even. What protective or social distancing measures are in place in accordance with sort of federal guidelines? Will you have to wear a mask? Will you have to stay 6 feet away? A lot of times when people visit, they want to bring food or a present of some sort. Will that be allowed? Can you do that? Or are you restricted from doing that? And finally, you need to ask yourself, are you doing everything you can to minimize risk? So if you wake up and you're not feeling well, maybe it's best to cancel that and schedule that at a later time. Just making sure that you're doing the right things yourself and not going in and bringing illness to a facility.
Terry, you were talking about, so some of these things are recommendations, some of the things are things the state is requiring or paperwork and things. From the Alzheimer's Association, you've been looking at some of the things that you feel should be in place for these long-term care facilities. So what are the things you think should be in place to make sure everyone's safe?
That's correct. So the Alzheimer's Association has released some long-term care facility policy recommendations for COVID-19. And a lot of them have kind of been touched on already. They're things that a lot of these facilities are doing because obviously they have the best interest of their residents in mind. But these are just some guidelines that we've seen that are some of them specifically tailored to people with dementia who might have a harder time understanding the need to wear a mask or following the kind of cues for hand washing and those sorts of things. So that breaks out into 4 categories. First is testing. Everything starts with testing. The recommendation is that on-site testing capacity and capability should be at all facilities, supported by policymakers, so that they can ensure that all of the residents, all of the staff members, and any visitors, if applicable, are free of infection and keep the residents safe. Obviously, testing has been a big discussion point all along, and who has enough capacity. But then once the tests are done, reporting is the second category that we have recommendations for. And the sort of overarching recommendation is that reporting should be done immediately in the case, if there's a positive test, and that the data from the reporting with policy measures in place to protect people's privacy, that reporting should be made transparent and publicly available, so that people throughout the state, whether they have a family member in a facility, here in the Omaha area and Lincoln, across the state, they know what's going on. And then the last 2 are surge activation. If in the event that there is an outbreak or a hotspot, we should have support from the state for surge activation, activating what's kind of known as strike teams to go in and help those facilities deal with those situations. And also making sure that the long-term care ombudsman and Center for Medicare and Medicaid surveyors are designated as essential and can get into those facilities to do the reporting that they need to do. And then lastly, just providing support in general, making sure that all facilities have access to all of the PPE needed. This is obviously a high-risk population who has been hit very hard by this disease. And so that PPE being available, being clean, having enough of it to not have to reuse it is going to play a huge role in making sure that they remain safe. And also in terms of that support, disseminating essential dementia care recommendations to provisional staff who maybe don't usually work with folks with dementia, just to ensure that there's an understanding of how some of those behaviors are different for a person with Alzheimer's or related dementia.
Yeah, and Laurie, I know that that's an issue with your mom. You were saying too, it just even during that time you weren't able to communicate with her. It wasn't as simple as you could just pick up a phone and FaceTime with her. And some people may think you can do that, but it depends on where your loved one is at. So seeing her in person, what was that like?
Well, just like we were talking about, they had a lot of precautions in place. I did have to call in advance before I could go see her. And when I got there, so that they knew I was coming and they would have her ready, I had to make that schedule. And then when I got there, I had to be buzzed in where I could sign in, and then actually signed a waiver, that had all those questions that you ask whenever you go to the doctor or any place now. Have you had a fever? Have you been sick? Do you have are you not feeling well? Have you been out of the country? All those kinds of things. And then you sign, off. And then you need to be masked up before you can come in to do that too. And they had sanitizer and stuff there for you to use. So, and then I went out and waited back outside, and then they brought her out to me in an area that had been designated with chairs. So, since it's outdoors, now we're having to plan, like, is it get too hot for her to be outside when it's 100 degrees? And could she handle the heat? And, and is it raining? So, and it is, an hour for me to go, plan to see her too. So there's just a lot, involved, in it. But I think I was pleased at the level of, precautions. I thought it went really smoothly.
I'm sure though, and I'm sure there are concerns that all people have of, you wonder and you hope, what actions is the facility taking for your loved one? Because it's not just the facility, it's of course everyone who works there and anyone who at this point may be visiting. So, Laurie, is there some anxiety feeling about that?
Oh, totally. leading up to this in the last several months, I've tried to be as careful as I can, not just for my own health, but in anticipating a time that I would be able to go in and see her again. So I'm extraordinarily precautious, take every precaution I can. I mask up everywhere I go. Hand washing, taking care of things that come in the house, and anyone that I'm near. I'm extraordinarily socially distanced right now, and grateful, I must say, that I'm able to work at home and make that possible. But I'm doing everything I can personally so that if I, when the time comes that I, could go see her, or even the day comes when they let us in, to their rooms again, that I'm safe. Because the anxiety of and I got home that night, to tell you the truth, and even with everything that we've done, and I got there home last night, and I thought, God, I hope that that I'm okay, and that she's okay. Everyone that goes in and out of there is okay, because it's such a fragile situation. And we really, really depend, our family members and the people who live there, we really, really depend on people that work there and come and go, to just do their best to, and very fortunate that there has been no COVID in the facility that she's in. So far so good, what they're doing. And I think perhaps the facility she's in maybe even a little more precautious than, than even other facilities in the area. So I'm grateful for that.
Have Terry or Todd, is that my mic there? Sounding a little funny. Sorry about that. Have we heard recently, we just heard an update from Douglas County, and they talked about clusters, but it didn't seem like this is an area we're hearing about as much right now. Have either of you been hearing about any more outbreaks that are particularly alarming, or at this point, do we think those may have evened out a little? Obviously, anyone that has happened is tragic and horrible, but where are we at that point?
So I'll start. In sort of even preparing for this, I tried to go back and find out the latest numbers for cases and deaths at long-term care and assisted living facilities in Nebraska, and I couldn't find anything recent. Going back to what Terry just said, I agree completely on the transparency notion. We need transparency. We don't have transparency, and Nebraska is in the minority of states in not providing sort of a regular update of places in which there are cases and deaths in long-term care facilities. And so for our information, we rely on the press asking the governor at his press conference about the latest numbers, and that I don't think has happened recently, and so I don't have recent numbers. I'll say nationally, I think the last number I saw was over 40% of the deaths are related to long-term care nursing home facilities. At one point in Nebraska, that number was close to 70%. And so, that was the major source of deaths in the state at one point. Where that is now, I don't know. I also saw some recent information from the Kaiser Family Foundation in saying that they are starting to see an uptick in cases and deaths in nursing homes across the country again for those states that report that information, which is disconcerting.
Yeah, about that with the governor's news conferences, they aren't as regular as they used to be. And I will say that for anyone watching, I can comment on the fact that the governor gives aggregate data. So in other words, he will give numbers based on, let's say there have been so many cases at long-term care facilities and so many cases at like a meat processing facility, but they will not break down the numbers by place or numbers of people at each place or naming places. He cited different reasons, HIPAA being one of them, and also saying that they don't track it that way. But I know that is a concern among many people of it would be good to know which places. And I know our investigative team, our I team, definitely anytime we get people who contact us and say, hey, you should look into this place. I know there's been a high number of cases, and so we do try to track those as much as possible. But a lot of times we're also kind of in the dark with some of those numbers. So
yeah. The facility that my mother is in. Oh, I'm sorry. What happened there? The facility that my mother is in. I get something in the mail from them
Yeah. And if I can speak on that a little bit, I would like to, you know, again, I guess echo Todd echoing me, that, you know, what we're looking for is that public, transparent data. Even our neighboring state, Iowa, they have a dashboard that features how many cases in long-term care and what facilities and what counties. And there are definitely ways to do this. Other states are doing it. I understand concerns about privacy, absolutely, but there are ways to make this information available, de-identified, while protecting the privacy. And so I have watched a few of the conferences and I've heard the questions being asked, so I appreciate that. And I one of the numbers that I've recently seen, Todd was mentioning the percentage of deaths that are from long-term care. Beyond that, just seniors in general, the most recent number I remember seeing is for folks over 65, less than 10% of the positive test results were folks over 65, but 72% of deaths were attributed to the same demographic. And so that, I think, really puts into perspective just how vulnerable this population is and how important it is that we have this support and testing and reporting to make sure that we're, you know, finding these hotspots before they get out of control, and that we can actually, you know, do something to help ensure that these folks are staying safe. And I say all that, of course, too, I want to recognize that the folks working in these long-term care facilities have, many of them, been doing just an incredible job, a Herculean effort. We've heard about facilities where the staff has moved in for a month at a time so that they aren't leaving and coming back in and potentially introducing the disease into the facility. You know, they're doing great work, and unfortunately, the state of our long-term care workforce is such that they don't have the support that they need, the staffing that they need, and so they're being forced into these situations where they have to make those kind of sacrifices, and God bless them, they are, but it's a huge task they're up against.
Yeah, Terry, and Laurie had mentioned how her mother's place sends updates all the time, and that is something we've heard that individual places, again, are taking it upon themselves. And I think everyone would applaud everyone for being transparent and letting people know what's going on in their facility. But the issue you were saying is that it's not regulated, that they have to do that. But I guess, is that something you're seeing or hearing about, that most places are communicating with the people in their facility?
We have been hearing about that, facilities, you know, making the choice to report those situations when they arise. As you mentioned, though, the problem with that is that it is not, you know, across the board. It's not universal. And what we see with folks with Alzheimer's and related dementias is often their caregivers are, you know, a long distance away or out of state, especially with the facility closures that we've seen in recent years in rural areas. These folks are often far from home being taken care of. And so, you know, those individuals might not get the notifications. They might not get the information. The primary caregiver might, but then the other family members might not. And so that publicly available data is so important for those situations. And like you said, of course, we salute those facilities who are reporting those numbers and who are being transparent, because they have the best interest of their residents in mind. But in the situation we're in, with this disease being as serious as it is, and those residents being so vulnerable, we need to go the extra mile and make that information available.
yeah.
Yeah. You know, I see in one of the comments, it wasn't on the screen, but Nebraska's numbers are not bad. I just want to address that quickly. First of all, we are not saying they're good or bad or anything. We're just saying that this is an issue that is being dealt with. I will say that Douglas County did give an update, and Douglas County Health Director, Dr. Adi Poor, said some of the recent data is, quote, worrisome was the word she used, and that's because they are seeing some upticks in Douglas County, One thing is the hospital capacity. There are more people in the hospital right now, which people point to the fact that that goes up as elective surgeries are now being allowed to. So there are other factors at work for sure. But we're not trying to say Nebraska is the worst state or anything like that. We are simply trying to address that there is an issue that our society is dealing with right now, and how can we come together to deal with it properly and make sure people are getting the care they need. Todd, perhaps a question for you. If someone, and this would be true of any time, but especially right now, if someone had any questions or concerns about the care their loved one was receiving, what do you recommend? What are recommended steps of who they should go to, what they should do? Where do they start?
Yeah, something that Terry referenced earlier that I agree with. One place they can go is the State Ombudsman's Office. The State Ombudsman's Office is there to watch out and protect the rights of residents of these facilities. And I agree completely with Terry, is we need to make sure that as these places are opening up and allowing visitors, we're also allowing the ombudsman to get in there and to be able to talk to residents and families and make sure things are okay. So the ombudsman's office is one place that people can go to if they have concerns. And then just in general, these places are regulated and inspected by the state. So you can go to, there's a hotline with and I wish I had it, but I don't have it off the top of my head. You can go to the Department of Health and Human Services for the state of Nebraska and also report any concerns there as well.
Because yeah, those are obviously tools people need, not even just during a pandemic, but at any time. Sometimes you have questions about the care your loved one is receiving. Terry, you were talking about this a little bit, and I know Laurie was as well. But what are some of the concerns and the procedures that are in place? How do you deal with someone who has dementia during a time like this? I mean, you think about it, and I think your heart breaks for people who may not necessarily understand why they aren't able to have the contact they've had in the past. So what's being done for folks like that?
Yeah, so one thing that I'm very proud of is Alzheimer's Association has sort of a hub on our website for COVID-19 that includes, tips for dementia caregivers. It includes information, including our long-term care policy recommendations. And these tips for caregivers are for those with the loved one in the home or in, a community setting, or those who are receiving home-based services. So one of the things, a few of the things that I can highlight just sort of off the top is that, as I mentioned, folks living with dementia might have a little more trouble understanding why they need to wear a mask or wash their hands all the time, or why their loved ones can't visit. And so, our recommendations include, having notes around that are reinforcing that cueing to be, following good hygiene. It also includes, understanding the need to be patient and work with the individual because it can be, it's a stressful situation dealing with this disease. But then, we also recommend a lot of the same things that are generally recommended in terms of, making sure that you are prepared for the event that if that individual does receive a diagnosis, making sure that you have a plan in case the caregiver receives a diagnosis. And then also just some general, hygiene and cleanliness around the house, so that even if the individual's hygiene is suffering, you can help make sure they're safe. Cleaning and disinfecting frequently touched objects and surfaces, having hand sanitizer available if hand washing is a challenge for that individual, if they're not able to understand. The hand sanitizer can be a good substitute when you're not able to do the hand washing, although hand washing is obviously the best. So if people are interested in more of those tips and more of that information, that's available at alz.org/COVID-19 help. As I said, there's a bunch of tips available for caregivers, whether it's in a home, in a care facility, whatever it might be. And the other thing too is to give us a call at the Alzheimer's Association. We have a 24/7 helpline. So if you have questions about how to handle any of these situations, 800-272-3900 is the number. It's staffed by master's level clinical social workers, and it is available 24/7, 365, whenever you need help. So please reach out.
Todd,
Yeah,
one
and
of
I just
Go
want to
ahead.
give a shout out to the Alzheimer's Association also, you know, because you have been a resource for me, and I have, you know, in the past taken advantage of support groups and other things that you offer. So if you are somebody who's caring for somebody who has Alzheimer's, or you're separated, you know, or maybe you just are getting that diagnosis for a loved one or even yourself, there's a lot of resources at that organization, and it's been very, very helpful to me as well. So shout out to Alzheimer's Association.
I'm very glad.
Yeah.
Todd, one thing I've noticed or heard, just people talk about, that because of this, other people may not be going and seeking the care they need for other things. I know it's a little off topic, but is that something you're seeing and hearing, and something that the word needs to get out, that people need to care for themselves, especially the older population needs to care for themselves during this time, and while they may be protecting themselves a little bit, not to be fearful to go to the doctor or hospital and tend to needs that way.
Yeah, and I think what's been great about this is, I think, originally when this first started, we had a lot of sort of lockdowns, and we're now able to go back and do elective procedures and things like that. The other thing that I think has been a positive out of this, if you can find positives, is sort of the increase of the use of telehealth, both for sort of physical health and mental health. And that's something I hope that even as we come out of this COVID on the other side, that we'll continue to support at the state and federal level the use of telehealth services. And so there are other options. If people are concerned about getting out and going to see their doctor, they should inquire with the doctor about the availability of having some sort of a telehealth appointment as well.
Laurie, has the facility, and obviously this has to do with different laws within counties and states and whatnot, but has your mother's facility talked about next steps at all? Has there been any hint or talk about when it might be more than that outside visit? I don't know that you'd want that at this point, but is that something that's been a discussion at all?
Yeah, well, like I said, they do send us that update letter periodically. And every time you get it, you think, is it changing, and what's changed? And I think, like, I don't know. I know that they're following all the recommended guidelines for the state of Iowa, but I think maybe they're, going above and beyond as well, which isn't necessarily, which isn't to me a bad thing. I mean, I'm anxious to see her, of course, but I'm, grateful they're being cautious. But, I believe that there is a concern in Iowa that maybe their numbers are not going the way they should be. Now she lives in Southwest Iowa, where the rate of infection has been, thankfully, quite low. But when you see those numbers fluctuate, and they're keeping an eye on those numbers too. And I don't think they're going to do anything, even if the state of Iowa says something's okay to do. I think that the place that she lives in, they're going to make their own decisions based on what's best. They're going to do of course, what the state requires, but I think they may be going a little bit beyond it. But no, at this point, I have no idea when I'll ever be able to get back inside, into her room, and it's hard. I mean, she's very content right now. She doesn't actually have the same concept of time as we do. So she doesn't, I don't think she has a concept exactly of how long it's been. So, and I'm, in some ways, I'm grateful for that, as odd as that sounds, because she's not as anxious about it maybe as she would be if she did, So for now, we're kind of in a holding pattern, and, she's content, and we're just waiting it out,
I know it came up earlier of, no gifts, no food brought when you go visit, things like that. But, that is something of, if you have someone staying in some sort of long-term care facility, what should you be doing or bringing or giving to support them? I mean, they need to support the time, pass the time like all of us. So what are some of those good resources?
You know, what we did was, I've been sending her, little things, she loves chocolates. And so I've been sending her little chocolate minis for the room, and she shares them with the caregivers. I've sent her, once in a while, I'll send her a new pair of, jammies, because I know she's lounging around a lot like we are. And, and then I found something online that I thought was pretty interesting. I hadn't seen before. I actually investigated and found that there are books specifically for people with dementia or Alzheimer's. And she always loved to read, and so she's not able to concentrate on a book, a long story like that anymore. But they make these books specifically for people with Alzheimer's and dementia, that are, they're not, they're adult for adults, not children. So picture books of, flowers or birds or a day at the farm or a day at the beach, small captions because she's still able to read. And just something that she can flip through and keep, her mind occupied. So I sent a bunch of those to her, this last week too. But, that's my question too. It's like, what can I do to keep her engaged? Because she's in a room by herself a lot. So other than phone calls, I know they're doing some therapy with her and some, engagement with with this nursing staff and the therapist there. But like, what else can I do to keep her mind engaged during this time when she's not having meals with other people like she used to? She's having her meals in her room. She's, not able to go around and have visitors, come into her room. And like, any ideas on like what else I can do or send her?
I'll go in for a second. I know my mom recently had a stroke, and she's still recovering at home, and she can't fully do these yet, but she'd requested something she did early on in the pandemic, ordered it off of Amazon. They are adult sticker books. And
really?
I know that sounds silly, but she loved them and she showed them to me, and I'm like, that's great. It's seriously like you said, it's adult. It's a beautiful flowerscape or a bird. It's not just little stickers of a little. And you can actually, like a paint by number, you take the stickers and put them in place to come up with beautiful scenes. And it was something, because you hear word searches and things like that, but it was just something or coloring books and things. But this one was a little different, and I thought it was a great idea, and I was amazed at the number they had. Actually, I'm sure you have more. Yeah.
Can I ask Laurie a question? Do you get regular updates on your mom's activities, daily activities? Do you get does the facility provide you with that information on a regular basis of what she's been doing and how they're engaging her?
That's a good question, because she can't really tell me. According to her, she never leaves her room. But according to, we have periodic updates where the entire team that cares for her, they get on the phone and we do a conference call. And that way my brother, can also join in on those calls if he's able to. So, and they go down, they run down everything, her meds, her stuff, her, her, what activities, who's coming in and out of her room, what therapies she's getting. And yeah, so, and I know that if I had any anxiety, I'm sure that they're a phone call away and would answer whatever questions. But, but beyond that, I mean, it's a small room and she's there by herself. I mean, I know how isolated I feel being here. And, she used to love to read and love to sew and never watched television. She was always, busy with handwork and all, and she just is not able to do those things anymore. So just like how to keep her mind engaged when you can't be there to spur those memories on or interact with it. Hey, look at this photo book. We used to, be able to look through photo books together and, reminisce and, so any ideas anybody has for that, I'd love to hear it. And maybe even anybody who's watching in the comments maybe has a suggestion. I'll take that too.
I'll make an idea for a helpline. That's something that they might be able to provide you with answers of what are some good activities or things that I can send in or provide. We also encourage residents caregivers, it's in our recommendations to inquire about the different ways you can have contact. As you mentioned, phone may not work, video may not work. That can sometimes cause more confusion. But also to the point of getting updates, we encourage everybody to contact the facility and ask how you can keep in touch with facility staff so that you can get those updates on a more regular basis. But of course, it's going to vary for everybody, but I do think that our 24/7 helpline would be able to answer some of those questions and give some recommendations, if nothing else.
Yeah, thank you. Thank you for that.
I think if people are just tuning in, I want to kind of reintroduce everyone and do a little bit off the top that you had told us about. So we have Laurie LaMaster, who is a coworker here at KMTV3 News Now. She is someone who is speaking on her experience with her mother, who is in a long-term care facility, and being able to see her outside from a distance recently. We have Terry with the Alzheimer's Association, and then we have Todd with AARP. And let's just start and go around again a little bit. Terry, talk about, you had wanted to address some of the policy issues that the Alzheimer's Association is interested in regarding COVID-19 and the Alzheimer's population. So talk a little bit about what your focus is right now.
Sure. So with the legislature back in session for the remaining 17 days, we're keeping an eye on what they are, looking at doing related to COVID and long-term care. We have a number of policy recommendations that we've reached out to the unicameral and to the governor with, just to ensure that, these are things that are maybe a little more tailored to folks with dementia, because the approaches and the needs can be different. To do just a quick rundown to review what some of those things are. There's 4 categories: testing, reporting, surge activation, and providing support. Testing, really pretty basic, just ensuring that all long-term care facilities have the testing supplies and training they need in order to ensure that all residents, staff, and visitors, if applicable, are healthy and free of COVID. Reporting, making sure that those results are reported. If there's a positive case, it needs to be reported immediately, and making sure that those numbers are made publicly available and transparent with, of course, appropriate safeguards for personal information. Surge activation, having support from the state government to provide that surge activation or strike teams, you might call it, in the event of an outbreak or a hotspot developing at a long-term care facility. And then finally, just providing support, making sure that there's adequate PPE provided to these facilities to ensure the safety of their residents. They're at a much higher risk. They're very vulnerable to this. And so, having new, clean PPE that doesn't have to be reused is essential for them. And then the last thing, as I mentioned earlier, is making sure that the long-term care ombudsman and Centers for Medicare and Medicaid surveyors are designated essential and can get in and do that important reporting to make sure that the residents are safe, that everything's being done appropriately, and that everything is, safeguarding their health.
Todd, I know the AARP has some very similar things. Go through, you were talking about those 5 steps or the 5 questions that people should be asking of their loved one's care facility.
Yeah, and if you are interested in more information, you can find these and other resources at aarp.org/caregiving. In general, the 5 questions focus on questions that you can ask your facility where your loved one is, and even some things to ask yourself before you do it. What is the nursing home doing to protect visitors when they come in, to make sure that the facility is safe? What kind of health checks will be required for visitors? Will they need to take their temperature? Will they ask you about any symptoms? Are visits restricted by time and place? Will they have to be outside? Do you have to get an appointment to come visit? What protective and social distancing measures are in place in accordance with federal guidelines? Will you need to wear a mask, stay 6 feet apart? And again, can you bring in something for the resident that you're visiting? And are you doing everything possible to minimize your own risks in going? So when you wake up, do you have symptoms? If so, you might want to think about canceling your visit. Again, it's a mix of things to ask the facility so that you know that you're being safe, and also that you have confidence that as other people are coming in, that the facility is being safe as well.
And Laurie, you talked about your experience, but it sounded like you had a lot of things were in place to make sure that everyone was staying safe. If you could talk a little bit again about what your experience was,
Sure.
Yeah.
Yeah, I did have to let them know before I went. I had to schedule of my visit. And then when I got there, I needed to be buzzed in just to like the front vestibule area where they had sanitizers and masks if you didn't already have one, which I did. And then you needed to sign off a waiver with basically a lot of the same questions that Todd was just saying. Do you feel well? Do you have a cough? Have you had a fever? Has anyone in your household been sick? Have you been exposed? Have you been out of the country? You sign off on that. And then I went outside, and there's an area at the entrance to her building that I was able to pull a couple chairs out, and they brought her out to me, and that was the first time I'd seen her since March, and that was just last week. But we had a really lovely visit. It's good that we have to schedule these things because you can't just pop in, but also, I mean, with the heat and the rain and whatever, you kind of have to think about what's a good time for your loved one to be outdoors if they're weakened, or if they're sensitive to the heat or cold. So, and that was just this first time that I went there. They may have a completely different setup when I go. They may have more of a sheltered area set up this next time, but I made sure that I was healthy, had been distanced, was doing everything to keep myself COVID free, so that when the time came that I could go see her, that I could just, like, as soon as I got the word that I could go, I went.
Yeah, with that, the moment you saw her for the first time, what was that reaction?
For her, it was just like, oh, it's you, like she has no idea how long it's been. Because, and like I said before, thankfully in some ways that she doesn't realize, just how long it's been. But yeah, for me, it was, guys, seriously, I mean, it was very emotional. I mean, hey, when you see your loved one for the first time, don't be surprised if they've lost a little weight, if their hair isn't like it used to be. Her hair was clean. She was clean and well taken care of, and all of that. But it was just, I'm used to seeing my mom with her hair a certain way, and I'll do it for her when I used to go and help her do it when I would go to visit her. And so, like all of us, we all maybe be in a little need of a haircut. But yeah, it was, I think it was probably, to her, it was just like, oh, yeah, you're here. And gosh, and then we do kind of have to go through the explaining, like, well, why are we out here? Why can't you come to my room? And, I can't, I just can't come see you. Well, why is that? So we go through a lot of the explaining what's going on. And that's anytime I call. So like I said, she's content. The only thing that really bothers her, that she remembers and notices that she's not doing, is eating in a group with the rest of her group, and that she's getting her meals in her room. So she does miss, that has really stuck, that she misses that she's not having meals and, more interaction with the people that live there. But other than that, it was just like, oh, yeah. And this is a funny story, and I'm sorry, Mom. Sorry, Mom. But it was that night when it was really kind of a little bit chilly. I don't remember if, like, last week, it was like the first kind of cool day that we had. And so she was sitting outside, and she had a short sleeve shirt on, and she just kept, I think her room must be really hot all the time, but she was like, I said, are you cold? You know, she was like, you know, and also don't be surprised if maybe they're a little anxious at the idea of being out in this situation that they haven't been in before. I think that, you know, after a certain time, your room and all of that really becomes a comfort zone, I think, if you've been there long enough. But anyway, she was quite anxious and kept telling me that she needed to get back to her room because they told her she was getting a visitor. I'm like, that visitor's me, Mom. So she goes, no, I don't think so. They're coming to my room. And I said, well, nobody can come to your room. Your visitor is me.
Just me.
And she's still the mom. She's still the mom, though. She looks at me as like you don't know what you're talking about. She can still put me right.
Oh, I love it.
And my mom can still put me in my place. Yeah. But
that is something though too. I'm sure you know, we get in routines, and it's now been long enough that the routine has become not leaving the room much and not doing all of that, that now going back to somewhat normal or starting that way, I'm sure does feel odd again. So
yeah, I think it's like why am I out of the room outside in a chair? Why aren't you in my room? You know, I mean, yeah. So I could tell that it was causing her a little anxiety to be out, you know, to be out there, and couldn't quite understand why I couldn't come inside. But, you know, it was great to see her.
yeah. All right, everyone, I appreciate this so much. I think we had a great discussion. Is there anything you would like to say before we close out? I hand over the mic to anyone who has any parting words on this.
Well, I'm wondering, Laurie, why I need a haircut, but I've not lost weight during this. I'm wondering what I've done incorrect.
Oh, I haven't lost weight either. Believe me.
Again, I would just point people who have more questions about this from a caregiving standpoint, like you, Laurie, or going to visit a resident, to go to aarp.org/caregiving to find more information.
And I would share again our 800 number. It's 24/7 helpline, 800-272-3900. Any question that you have, whether it's COVID related or not, you know, we have somebody who can either give you the answer or get you someone who can, or visit our website at alz.org/COVID-19 help. You're not alone in dealing with this as a caregiver. You don't have to be. Please reach out if you need assistance, because this is a difficult time, but we're here for you.
Yeah, and as mentioned earlier, go ahead, Laurie.
And I guess what I'd like to say is just my deepest gratitude, respect, and love for those who are taking care of our loved ones right now, because it means the world to us that especially how well taken care of she is. It means everything to us. So my deepest respect for people that are doing this work on our behalf. So thank you.
I think that's important too. I know it's our job sometimes to you know, look at places and find out if there are any issues and problems and shine a spotlight on some of that. But sometimes I hope people realize that as we're doing that, we also want to make it known that there are a lot of fantastic people, fantastic places doing really amazing work for the people we love. So such a strong message there. All right, thank you so much. I appreciate everyone helping out. And I always wave at the end of these, and I don't know why, so I apologize for that.